Amanda came into the clinic today and she sustained a 3rd-degree burn to the dorsal aspect of her right forearm, wrist, and hand after a gas stove exploded in her kitchen about 1 week ago. Due to acute injury, the orthosis we'll be making today will be a volar base hand, wrist, and forearm orthosis, emphasizing the intrinsic plus position. The orthosis that we picked plays a critical role in preventing contractures and maintaining the length of her tissues while she heals. Due to scarring and the injury, her hand would go into an open pack position. We want to emphasize on the anti-deformity position and intrinsic plus position of this orthosis. This means that we will place the wrist in 30 to 50 degrees of extension, MCP joints 70 to 90 degrees of flexion, and the PIP and DIP joints in full extension. Place the client's hand, wrist, and forearm on the paper towel. Make sure the digits are in full extension and the thumb is in abduction. Place the pen in between the radius and ulna and make sure to not ulnarly or radially deviate the wrist. Mark the following landmarks: radial styloid, CMC joint, thumb web space, proximal to the second MCP joint, in between the second and third web space, proximal to the fifth MCP joint, and the ulnar head. Two inches from the elbow crease, mark 3 finger widths apart from that landmark. Mark 2 finger spaces from the radial styloid as well as the ulnar head. 1 just proximal from the 5th MCP joint and 1 from the thumb web space. Connect your dots. From the second and third web space, connect the line down from the thumb web space. Make sure to mark X's on this because you do not want to cut this area when cutting the pattern. Connect the dots, making a semicircle.
The thermoplastic material that we chose has characteristics of 1/8 thickness to keep the joints from reverting towards extension, memory for frequent adjustments, moderate conformability, and moderate elasticity.
Once the pattern is cut, place it back into the splint pan to activate it before molding. In the meantime, position the client in the anti-deformity position or intrinsic plus before molding the orthosis. Due to the nature of the acute injury, the strapping that would be required is an ace bandage and a small strap to keep the eyepiece in full extension. Strapping. Place the strap over the eyepiece to promote full extension. Due to the acute stage of the injury, strapping is not required for the wrist and forearm. Therefore, the therapist will place the ace bandage circumferentially, covering the hand all the way down to the forearm.
So just to reiterate, the wearing schedule is going to be day and night, and this is going to help to prevent the skin from tightening and causing contracture of any of the joints as the skin is healing from the third-degree burn. We're also putting the client's hand in an intrinsic plus position, and this is to prevent any contractures as well due to the shortening of and tightening of the muscles. So this is in the best joint position.